and I'm going to ask you one more question that someone wrote into the Q&A, because I think it's pertinent certainly to this conversation. With antidepressants for the SSRIs and down-regulating serotonin, doesn't that affect the uptake of HRT hormones and melatonin for sleep? This question is completely foreign to me, but you would be the person to ask.
So I think that, again, every person is different. I've had people who were on SSRIs and really felt like, oh my gosh, it worked really well with my hormones. And others who are just like, I can't, So, but I do think we need more research in it. And what you're asking is something that is so like biochemical and so like precise that requires a lot more studies. And every individual is different. And so I do think having more options and knowing that this exists as an option is very helpful. I do a lot of studies with postpartum depression and looking at neurohormones. And I do think that that's an entire landscape that we're going to be able to see more research in. And that's not an SSRI. It's not a hormone in particular, but it's a neurohormone. It works in the brain, similar, and trying to, even out fluctuation. So I do think that there needs to be more research. And what I would say to this person is, rather than trying to figure out what's happening with this, is it going up? Is it going down? Try and write a log as to how you're feeling when you're taking these medications, right? Try and see, okay, if I took this for 6 weeks, what symptoms got better? And there are great rating scales that patients can use to parse out their symptoms of depression to see, and this is what I use in my practice because I run a research lab. In order to see if someone's getting better or worse or staying the same, we do clinical rating scales. So some of them are clinician administered, meaning I administer them with the patient, and some of them are the patient filling them out. And in your practice, in your private practice where you're seeing your doctors, they may have access to these scales, so you can actually fill these scales out and take a log as to how you're doing and look at specific symptoms of depression or anxiety to see which ones are getting better, which ones are getting worse, which ones are staying the same based on your treatment regimen over time. And it could be that it has nothing to do with the medicine. It could be something happening in your life that is, or lifestyle changes, or people in your life or situations that are impacting the way that you respond.